signs of active labor would be regular contractions. Active labor means that your body is actually making the changes and getting prepared for birth. There can be an increase in bloody show. You're going to have more difficulty talking through contractions, may get to the point where you feel that urge to push. So those can, and again, those can be any length of time. All of those things could take a really long time, or they could come really rapidly, just kind of depending on your body and how your body responds to labor. So the 3 stages are, the first stage is actually the labor part of it. So the labor part of it consists of early labor, the active stage of labor, and then the pushing and the delivery. The second stage of labor is the delivery part of it, and then the third stage is the stage of the labor where the placenta is delivered. So really that depends on how mom is tolerating labor and how baby is tolerating labor. ACOG has different definitions about what is to be considered an acceptable time frame for labor. So if we're inducing somebody and we get, like I said, there's criteria by ACOG, but if we get to a point where we've exceeded the recommended time frames according to ACOG, or if there's some factor that's happening with mom or baby, maybe baby isn't tolerating labor very well, or mom is developing maybe an infection or signs and symptoms of an infection, then at that point we need to decide that we need to do something different versus trying to go for a vaginal delivery. But really those factors are going to be unique to each mom, and we just do we monitor continuously to try to make sure that we don't allow any of those things to happen. So there's really not a right or wrong answer in that. It's really just how mom and baby are responding to the labor process. For a vaginal delivery, being in the delivery room, it can get a little bit chaotic for a bit. There's a lot going on. We have a surgical tech in the room who is the one who's manning all the instruments and everything that the provider is going to be using during the delivery. So there's going to be surgical tech, the obstetrician, or the midwife, whoever is going to be doing the delivery. There's going to be a circulating nurse for mom, and then there's also going to be a nurse for the baby. So each delivery, we would have 2 nurses at minimum. If we feel like we're going to have any issues, then we might ask for more reinforcements, more nurses to come in there. But that's really going to be our minimum. And then we also have, during the delivery, if we run into any complications, we have processes in place to call for extra help if we need extra help. We might call a neonatologist or a nurse practitioner to come into the room, or a pediatrician if that's what's available at the facilities. So if we needed to have extra help caring for the baby, we might call in those extra resources as well. For a cesarean delivery, you're going to have even more people. Still, again, we're going to have a circulating nurse for mom, circulating nurse for the baby. If you're having 2 babies, we have 2 nurses for the babies. We will have a pediatrician, neonatologist, nurse practitioner for babies. There's going to be a surgeon, a first assist, a surgical tech, anesthesia. So there's going to be a lot of people, but everybody has a job. They're all there to make sure that everything goes well with the procedures. So really, it depends on mom and baby again. A lot of these things depend on how mom and baby do. If it's a term pregnancy, everything's going well with mom, baby is feeding well, mom's stable, bleeding has been good, blood pressures are good, everything is good with them, you could go home at 24 hours. And a lot of moms do. But a lot of moms like to stay a little bit longer. So for a vaginal birth, typically what we would say is they can stay for 2 days after they've given birth. Cesarean is 2 to 3 days. Most moms, I would say, go home at 2 days, regardless of whether it's a C-section or a vaginal birth. I can tell you that when I had my 4th baby, I wanted out of there as quick as possible, and so went home at actually less than 24 hours and had to come back and have some of the labs done. But really, it's a lot of it is what factors into it is whether mom has kids at home. Because if you have kids at home, you probably don't want to be hanging out in the hospital for a couple of days, or maybe you do want to hang out at the hospital for a couple of days. Kind of just depends on what kind of chaos you have going on at home. Labor hurts. I mean, I'm not going to lie to you and tell you that labor doesn't hurt. There are lots of strategies like breathing, relaxation, those types of things that can help you. There are some people that go through labor and you would never even know that they're having any labor pain. But then there are others who don't tolerate it very well. So a lot of it has to do with pain tolerance and, just coping mechanisms, I guess. I would say that probably relaxation is the biggest thing, because if you think about it in respect to anything else, if you're tensed, it makes all your muscles in your body tense, and that makes your pain much more intense. So if you can work on relaxing those muscles through the contractions and try to keep the distractions at minimum, then that kind of helps you get through those types of Lamaze or breathing strategies. So pain management during labor consists of the relaxation, using those types of strategies, or we can give IV pain medication, or then we could also do epidurals. And epidurals, I would say probably 80% of women get epidurals based on some of our local data. So an epidural is actually the placement of a plastic tube, kind of a little catheter. The anesthesiologist would be called to the room, and basically what they do is they introduce a little needle, but then they place a catheter through the needle into the epidural space within the spine. A lot of people get confused and think that the needle stays in their back. That's not true. As soon as the catheter's in, the needle comes back out. There is not a needle in your back. It's a common misconception about that. So once the catheter has been placed in the back, we hook it to a tube, which is connected to medication on a pump, and you get continuous medication into the epidural space. And basically what that medication does is it bathes those nerves, and it helps to reduce pain in the lower part of your body. So we want to get it to the point where it is taking away the pain, but we still would like for you to be able to feel some of that pressure, so that when it comes time to push and deliver the baby, that you can still feel a little bit of that sensation, and it helps you to be a more effective pusher. I can tell you that I didn't have epidurals with any of my kids. I have 4 kids. Didn't have epidurals with any of them. And when I became a nurse, I was kind of a late bloomer, became a nurse when I was like 40 after having my kids. And I was a little judgmental to begin with when women got epidurals all the time. But over the years, pretty quickly, when I started taking care of women, I realized that it was unfair of me to maybe judge women for that, because quite honestly, looking at how they were able to relax with their labors and gaining more experience into that, I kind of wish I would have been able to have an epidural. Not enough to go back and have another baby, obviously, but I still felt like it would maybe have been, a great relief, because labor's painful. And I feel like, like we were talking about the best way to have a baby, I feel like however you get those babies out of there and make sure that mom and baby are both healthy, that's the best way to do it. So, pain management, bring on the whatever you have to do to get through it. Usually emergencies are because baby is not tolerating labor. Usually what we would see is maybe, because we do fetal monitoring and we watch the baby's heart rate during labor. So we have pretty accurate information about what's going on with the baby. And if we see a baby's heart rate drop, so a normal baby's heart rate is between 110 and 160, and we see a lot of variability, a lot of jumping around in there, and that just means the baby is doing well. But if we would see that heart rate drop down below what is the normal range, or maybe the baby doesn't have that variability, we know that the baby is stressed and we need to get the baby out quickly. So typically what our time frame is, if it's a true emergency situation, we would deliver the baby we would have the woman to the OR and delivered within 30 minutes of that decision time. But I can tell you that if it's a true emergency, my experience is that we can get them out of there within 7 to 10 minutes. And we're pretty good at that. Lots of experience.
So it feels like your abdomen is doing a crunch that you can't control. It feels like your muscles are literally contracting and you can't control it. Everything slowly tightens up and then it slowly relaxes. Braxton Hicks contractions stop on their own. Labor doesn't. If you're having contractions and in 20 minutes they go away and they don't come back for another day or two, you know you're not in labor. But when you're having contractions that are not stopping, then you're likely in labor.
When you are for sure going into labor, your contractions will go from being mild and far apart to being stronger and closer together. Contractions that are consistently a few minutes apart as compared to irregular contractions. If your contractions stop when you are up and about or when you're laying down, that is usually a sign of false labor, so give it more time. Your contractions when you are going into labor, you'll feel them in your back and they will go to the front. So it will be like a rounding pain from the back to the front. You can have mild contractions for quite a while. Just know that when they become closer together and last longer, even though you're feeling them as mild, you want to contact your provider and see when they would want you to go to the hospital. Contractions before going to the hospital for a first-time mom should be about 3 to 4 minutes apart and for about 2 hours. Contractions for somebody who's already had a baby, they should probably come to the hospital when they're 5 minutes apart for 1 hour. A mucus plug coming out, it could be a stringy discharge, a different discharge than your normal pregnancy discharge would be. It could be clear, it could be blood tinged, it could be pink, but normally it's like a gelatinous discharge. When you lose your mucus plug, it does not necessarily mean that you're going into labor. It could be within a few hours, it could be within a few days. It could not necessarily be related to labor at all. So when you do notify your provider, just let them know that you did lose your mucus plug and they may give you other instructions. When your water bag breaks, your discharge will be different than your normal pregnancy discharge. It will be more water-like. It could be an array of colors. It could be clear, it could be pink, it could be yellow, it could be brown, depending on what's going on inside the womb with the baby. So you want to let your provider know and also let them know the color of the fluid, and you'll probably be heading to the hospital if you believe that your water bag is broken.